All right, we are back. Thank you everyone for participating in the poll. It looks like your biggest hesitation, the hesitation that most are experiencing when evaluating a new vendor or integration, is lack of time and resources to evaluate. We get that here at CRIO, and that is definitely why we created the Partners Program. The directory itself is making it easier for you to find vendors, to connect with them, and to enable integrations with them all in one place. So hopefully you guys can have learned more about that throughout this expo. And here with another solution is Elaine with Inato. We're going to hear from her. And let me just spotlight you. All right, take it away, Elaine.
Thanks so much for the introduction. Hi, guys. My name is Elaine Menshoff-Haddock. I'm one of the customer success managers here at Inato. So I first just again want to thank you guys for joining today and tuning into our session. We are really excited to be able to present you with a few of the resources that Inato provides. And we will go ahead and kick it off a quick deck for y'all, but I wanted to spend some time demoing as well. So if you're not familiar with Inato, Inato is a marketplace suite of resources that are free for sites, and we have been partnering with CRIO to unlock a new level of success, giving CRIO sites direct access to more trial opportunities to apply for and some really powerful AI tools that help to reduce site burden, accelerate patient screening, and ultimately help you enroll faster. Now, going back to our free sources are free, we do this because we understand that a lot of services are at the cost of a site, and we really want to empower community sites with resources. So our business model works with sponsors on selection and innovation projects with the goal to build tools that sites naturally want to adopt. So coming into a little bit of background about Inato, we are an AI platform connecting sponsors and sites on a global scale on a mission to bringing clinical trials to all patients. So, really trying to bring research into communities and empowering sites to be successful on these studies. Our network consists of, not network so much as our site pool, consists of over 5,500 sites across the globe, so 50 plus countries, and we work with over 25 top global sponsors across over 100 studies. And that's consistently growing. We're constantly adding new trials to the marketplace to help it make more accessible trials for y'all. And so what this looks like with CRIO, just to give you a quick overview, and I'll of course jump into a demo to show you a little bit more about what this looks like and how it works using Inato's platform. We know that you're managing your studies in CRIO already, so we want to support you in finding your studies and pre-screening patients for the studies as well. So step one, add Inato to your daily flow of business development. Like whatever you're doing for business development, this is just one additional resource that is free to your site to use. So you can increase your access to trial opportunities and hopefully win some studies with us. And then, as usual, you're going to track those studies through CRIO as you normally do. The next step is to start pre-screening patients within Inato. So I'll show you how that works in a bit of a demo today. The idea is that you're cutting review time more than in half by reducing the time spent doing chart review and inclusion and exclusion criteria validation. So really, you're saving time and you're also reducing your screen fail rate because we are able to help you do such a thorough job of pre-screening patients. And what's great with our CRIO integration is that all this information will flow back into CRIO on the patient instant. So you can see exactly the pre-screening summary, any next steps that you need to take and pick up right where you're already working. So a little bit more about the platform if you're not familiar. So entirely AI-enabled platform where you can access trials and also pre-screen your patients. We co-built this entire platform with sites to ensure that it solves real problems. So not only does our team consist of folks who have worked at the site level, worked at the sponsor level, kind of everywhere in between. We also consistently build new features, new tools with site voices, testing on sites and helping them to kind of co-create and be able to really deliver these tools in a way that fits into the workflows that you guys are already using. So the trial access, you're getting to view trials across multiple sponsors, getting to showcase your strengths and kind of help you get noticed with these sponsors that you might not otherwise have a relationship with. And then even beyond study award for Inato studies, non-Inato studies, you can use our pre-screening tool to reduce screen fail rate, automate some chart review, and give you kind of that assistant to give you some of your time back with patients. So quick break from the demo, just want to jump in to show you how the platform looks and what you can expect. So starting here, we have your Inato profile, which you can very easily today, if you want to go and sign up and create. You can build it out up front or you can build it out over time. The great thing is that all of this information that you're adding about your site's experience, your staff, your interests, your recruitment strategy, your community engagement efforts, all of this information helps to autofill your applications in the future. So you're not repeating the same information on feasibility questionnaires over and over again. And what's great too is that, like I mentioned, with the AI powered kind of feasibility and profiles, we're able to auto pull some of this information for you. So if clinicaltrials.gov shows us that you have worked on 10 of these studies, we're not going to make you enter them manually. We're going to pre-populate them for you here. So we're really able to help kickstart your profile and help you add to it over time. So once you have your profile set up, go ahead and start to review some trials to discover. So you can view all the trials that are open to sites in your area and manage the entire process from CDA to protocol review to filling out the application directly on the platform. You'll click into a given trial and say, review some details about it, key inclusion/exclusion criteria, some of the information about the study. You'll see even how many sites are left to be selected on Inato. So you can really take those next steps for you here, and that's all centralized in one place. You can also manage those steps here, of course. So you'll see in progress, not only do you have a couple applications to fill out, but you also are following along on the status. So your site was selected for a PSV and you can see that here and you have some next steps to prepare. You know, you might want to share some availabilities for the date of the visit, prepare some documents so that you're ready to go for that visit. So this is a little bit about the feasibility side of the platform where we help sites to connect with trial opportunities and help them along through that process. The next thing I want to talk about is that AI-powered pre-screening tool, which is located right over here. So the great thing about this tool is that it's something that you can use across all of your trials. It doesn't have to be just the trials that you get through us. So you can easily add your protocols by adding the NCT ID or the protocol number, and we'll automatically set up that protocol for you. And from there, you can start to pre-screen your patients. Now, what ends up happening is when you click to add patients for, let's say, an asthma trial, you have a couple options on how you can go ahead and start pre-screening those patients. You can upload them one at a time. You can upload them in bulk. So you can default to PDF if that's where you want to start, but you also can integrate your EMR to make it even more seamless. So we can automatically pull in those relevant patients for you, and you're able to start pre-screening. As you start pre-screening, you'll be able to assign the patient ID identifier. So we always recommend doing something like your CRIO ID or the EMR ID for that patient, because once you do upload that, we're going to automatically redact all of the PHI from the medical record before storing it onto our system. The other great thing here is that you may upload them for an asthma study, but if they also have atopic dermatitis and you have a study for atopic derm on the platform as well, we're going to identify that and notify you to screen them for that study as well, just in case they might be a good match for both. So we're really helping you to kind of do that deep dive into patients. It takes just a matter of minutes to review each of these criteria. And I can show you that example here with a pre-prepared version here. So you're getting a line by line assessment on each criteria, right? Which is not eligible, eligible. If we can't find that information, we're not going to make a call either way. And what's great is you can click into each of these to validate that information. We never want you to have to rely entirely on AI. We're not trying to, replace the work that you guys are doing. You're the experts. We're just trying to give you that assistance to help you do this really quickly. And so once you kind of see the rationale, you can go directly to the source where this information is coming from. You can spend just a few minutes instead of an hour or so per patient making a decision about whether or not you want to screen them. And of course, make that decision up here. Now, coming back to what's great about managing your studies in CRIO and being able to use this as a free resource to help you pre-screen quickly and efficiently is that once you actually go in and just going to show you an example of a patient here. Once you go in and actually update the patient to be eligible or not eligible, you're going to see that their information will come up in CRIO as well. So just going to come back here. Sorry, just need to edit the patient for one moment. So I have this patient as ID1. Let's say that I had them from my EMR database, but I want to make sure that they match up with CRIO. I'm just going to make sure that the CRIO ID matches. And then you'll see as soon as I do that, I'm able to go and find my assessment for this patient within CRIO. So just going to take a moment for us here. And our patient, John Dodo, who we just renamed here at 11:51 Eastern, you'll see that we've marked him as to screen and we can see his entire assessment. So it's really instant and you do get this summary and kind of next step to screen the patient. And you can, of course, take those next actions from CRIO directly. Coming back to a couple other things I want to call out. So obviously, if you were here for other sessions earlier this week, there's a lot of pre-screening tools on the market. And just to call out some key differentiators here, we do have a really quick startup process. So we're not really giving you a lot to onboard with. It's easy to get set up and get started right away. And even if you do choose to integrate your EMR, for familiar systems, it takes about 1 to 2 weeks. For newer EMRs that we have to adapt to, 3 to 4 weeks. So really quickly, you can get started using this. And obviously, you saw how quickly the update pushed to CRIO. So it really is quite instant in that sense as well. And I did mention cross-protocol visibility. You are able to pre-screen patients against multiple trials, enabling smarter pre-screening in a fraction of the time, not having your coordinators have to go through and manually find every diagnosis and cross-reference against your studies. Another great thing, especially as AI continues to sweep our industry, is the dedicated support of real people, myself included. So we're with you every step of the way to ensure that success isn't left to chance. We want to make sure that if you need help integrating your EMR or figuring out the best way to adapt to your specific pre-screening process or recruitment process, you have someone to do that with. Same with the marketplace side. If you need advice on how to make your application stronger, we're here to support you on that. We talked a bit about integrations as well. And then I do want to highlight the accuracy of the AI that we've been able to develop. We're able to get about 95% accuracy on eligibility criteria, which has really helped to reduce the screen fill rate that sites are seeing at their sites. And so some of the impacts, some of the numbers I can share with you here, we're seeing an 80% reduction in screen fill rate with 90% faster pre-screening time. These are some of the early users who have adopted and been consistently using the pre-screening tool for pre-screening on their studies. And then again, that 95% accuracy on eligibility criteria. With one specific study on a recent trial, we were able to integrate with one of our site partners, EMRs, and pull in, they had over 74,000 patient records in their EMR. They had no idea which ones to pull for a given study. And what we ended up doing is having that integration process through those records. It identified about 1,300 patients that had the diagnosis and then identified 28 patients for screening. So this is something that took just a matter of minutes, which typically, as I'm sure everyone in the room here knows, that could take hours to achieve. Right. And I know we are running close on time here, so just want to call out, we take data privacy very seriously, data security. So we are HIPAA compliant, ISO certified. We continuously monitor and maintain those. I mentioned we do redact the medical records as well, so we're not storing PHI on the platform. And really only you and your authorized users on the Inato platform have access to any of this data. And last thing as I wrap up, I just want to say, like I said, we built this entire platform with sites for sites. So we're continuously adding and improving upon the pre-screening tool, the marketplace, our integration with CRIO, thanks to vocal sites and their amazing feedback. So we look forward to continuing to do that this year, next year, as to come, and we hope to see some of your faces among them. Feel free to contact us. You'll have my contact information as well. And we're happy to support you and partner with you on our next things.
Thanks so much, Elaine. Any questions for Elaine? Feel free to chat them. And if not, and if you think of any later, you can contact them in the partner directory located in the Help Center. Elaine, I really like how, AI is definitely can be scary, to integrate into our lives, but it's great that, with your system, you have the option to integrate it to alleviate the burden, but still, depending on your comfort level, still have oversight if you choose to. So that's great. Thank you so much, Elaine.